Today we will discuss jugular venous pressure, or JVP, and its waveform, an important part of cardiovascular examination. JVP is assessed by observing the pulsation of the internal jugular vein, which provides an estimate of right atrial and central venous pressure. Position the patient at about 45 degrees, with the head supported and turned slightly to the left. Look from the right side of the patient and identify the venous pulsation in the neck. The JVP is measured as the vertical height between the upper level of venous pulsation and the sternal angle. A JVP more than about 3 cm above the sternal angle suggests elevated central venous pressure, commonly seen in heart failure and volume overload. It can also be elevated in pulmonary hypertension, pulmonary embolism, cardiac tamponade, and constrictive pericarditis. To distinguish the JVP from the carotid pulse, remember that the JVP changes with position and respiration, normally falling during inspiration, and can be increased transiently by the abdominojugular test. Gentle pressure at the base of the neck can also obliterate the venous pulsation. The normal JVP waveform has two important peaks, the A wave and V wave. The A wave represents right atrial contraction and occurs just before the first heart sound. It is absent in atrial fibrillation. The V wave reflects right atrial filling during ventricular systole, while the tricuspid valve is closed. Prominent A waves may occur in pulmonary hypertension or tricuspid stenosis, while giant or cannon A waves occur when the right atrium contracts against a closed tricuspid valve, such as in complete heart block. Tricuspid regurgitation produces prominent systolic versus waves, often called CV waves. Another important sign is Kussmaul sign, a paradoxical rise in JVP during inspiration, seen in conditions such as constrictive pericarditis, severe right ventricular failure, and restrictive cardiomyopathy. Finally, an extremely elevated non-pulsatile JVP may indicate superior vena cava obstruction, where the JVP no longer accurately reflects right atrial pressure. So careful assessment of the JVP provides valuable information about right-sided cardiac function, fluid status, and important cardiovascular disease. Thank you.